Hello. Have y'all heard of the resource deprivation theory that has been affecting the Filipino community?
Does it have something to do with how only few people have resources?
Yes, you're on the right track.
What do you believe is the most effective way of preventing illnesses?
Honestly, just get knowledge. Know what resources are there so you can make the best and most informed decisions. And on that note, vaccinate.
Get that.
What do you believe are the leading causes of death for Asian Americans?
Cancer. Some barriers minorities have.
Language barriers might affect their access to healthcare.
Have you heard of the risk theory that endangers the Filipino community?
I have not.
What do you think is the best way of reducing illnesses?
I think the best way is giving better access to minorities and giving them more information.
What do you believe are the leading causes of death for Asian Americans?
High cholesterol. What are some barriers you see in minorities in healthcare? Just like having to pay to be in the healthcare industry.
What do you think is the biggest health threat for Asian Americans?
Diabetes.
In your opinion, what are some barriers to minorities in healthcare?
I believe one barrier for minorities in healthcare is accessibility to healthcare due to socioeconomic status.
Race and ethnicity are often associated with other dimensions of social disadvantage, including poverty, residential segregation, limited education, lack of employment, debt, low health literacy and low numeracy, and limited English proficiency. Hepatitis B is one of the largest health threats for Asians. They are 3 to 13 times more likely to die from liver cancer caused by hepatitis B. Asian Americans count for over half of deaths resulting from chronic hepatitis B infection in the United States. Asian American women in the United States, cancer is a leading cause of death, with research suggesting that it is due to lower access to screenings, cultural beliefs that due to reaching out for medical help.
The resource deprivation theory states that inequities exist because minorities are more likely than whites to live in communities that are deprived and lack the necessary infrastructure for a healthy lifestyle. High-income communities have access to fresh food, parks, pharmacies, and hospitals. Low-income and segregated communities live in areas where more fast food is available. Fewer supermarkets are available, and alcohol and snacks high in fat and sugar contribute to poor chronic health in minority populations. The risk theory states that high prevalence of social or environmental health risks in minority communities lead to a higher chance of disease or death. In context of the Filipinx community, according to the Social Science and Medicine Journal, approximately 42 Filipinxes per 1 million experience excess cancer incidents due to hazardous air pollutants.
To other barriers that were mentioned, some are language barriers, cultural beliefs, family relationships, value of family over personal needs, views of illness, lack of trust of healthcare providers, and understanding medical jargon. Black, Hispanics, and some Asian populations, when compared with whites, appear to have lower levels of healthcare coverage. People enrolled in Medicare and Medicaid receive less adequate care than average, suggesting a socioeconomic dimension to poor care. Medicare doesn't even cover medical needs such as prescription drugs, dental care, and long-term care, and it imposes barriers of out-of-pocket expenses for these families. Overall, the first step to solving these issues is being aware that these barriers exist, and that we as a community need to keep spreading this information and overcome these barriers to support our fellow minorities in receiving healthcare. Remember, healthcare is not a privilege, it's a right to any human being.
In minority populations, especially the Asian American demographics, many tend to deviate away from seeking care from healthcare professionals, believing that they don't necessarily need to. This is a current barrier that we all need to address, and I'm calling everyone into action. Focusing on preventative care is a major aspect of providing effective healthcare. Preventative care is a care you get in order to prevent illnesses and diseases, as opposed to getting care when you're actually sick. This is important because in the long run, it promotes quality of life, reduces hospital visits, and ultimately financially saves you. I encourage everyone to get checked and to push those around you to get checked. Support from a family member, a friend, or someone you know can greatly reduce the fear associated with visiting the doctor.
Hey y'all, so we wanted to film this video to showcase some of the aspects of minority health that may often be overseen in the health field. There are still many aspects of Filipinx and overall Asian American health disparities that still need more attention.
And one of the things that really spoke to us about FACT's mission was that we wanted to provide the resources for our community to, I guess, like not only educate the community, but also provide them the resources to like make the change in the community that people wanted to see. Because honestly, there are not very many organizations on campus that really address like such hard-hitting issues like this.
And with Health Conference 2020 coming up next year, one of the main goals FACT hopes to accomplish as an organization is to raise awareness of these minority health disparities, as well as how to optimize what we can do as future healthcare professionals or professionals in health in addressing these disparities, as well as how to guide others to do the same. And with that,